The idea for this came about because of a need that was expressed about the winter warming shelters and getting the homeless into the facilities, which was a barrier for folks who had issues with lice or scabies, who were getting turned away. The Sergeant Foreman at the Ventura PD came to us and noted that there was a real need for showers at the winter warming shelter, and he brought that to the healthcare agency and to Johnson Gill, and Johnson, in a room full of people, said maybe there's an option to have this on a more regular basis.
It was primarily our law enforcement partners who started the advocacy to try to get people access to some of the shelter programs. The person who really brought the CarePod idea to us was creating the same shower pods for fire personnel in the field. So bringing all of those great ideas together came to CarePodz.
Well, I'm the manager of the Whole Person Care program, and I'm the point person for the CarePodz project within the healthcare agency. Our shower pods are repurposed shipping containers, retrofitted to our exact specifications.
I'm happy to show you this wonderful pod. It provides shower opportunities for 4 people at a time. It's fully self-contained, has stainless steel fixtures for complete sanitation. We have a privacy shower at the end here where somebody can actually enter in a wheelchair. And so the people who provided this to us thought of everything so that we can serve all of our population in Santa Paula.
Individuals can come and register to take a shower. We will give them hygiene products, if they needed clothing, socks, undergarments, those types of things, and then they can go and take a shower, feel better about themselves.
A lot of them, this is the only shower they get. So they make sure they're here every Friday. I mean, everybody feels better when you're clean. You know, it's just like when you're sick and take a shower and you feel better.
Yeah, they make you feel human again. I mean, if you don't have a shower at least once a week, it gets a little depressing. This is like my first shower proper in 3 weeks because I had other places I had to go that I was limited to how I could get there. This place is like a godsend. And then you got your medical bus and you got your coffee. Very well-rounded, and people need this kind of thing. It's a good thing. It's a very good thing. That's one lady's opinion.
Hi, I'm Officer Gregory. I'm with the Ventura Police Department's Patrol Task Force. We've seen that these shower pods have given segments of our homeless population the opportunity to seek out an added level of dignity and hope in what can be a difficult and often discouraging lifestyle. Getting a shower and then being able to talk to a doctor, nurse, a social worker, and a housing rep can be that difference, and that's what these shower and care pods provide.
Yeah, as the Community Development Director for the City of Ventura, I have oversight over lots of things, but one of those unique things that I have responsibility for is the city's homelessness policies. Maybe they come in because they want a shower, but while they're there, they connect with a social service provider or the behavioral health specialist and get other services that maybe they didn't know they want or weren't ready for, but they come in because they have a basic need of a shower, and that's attracting them into the system. And so if this becomes something that they can go to once a week, and at some point they'll go for more than just a shower. They'll actually go for some care and then maybe decide that this is their chance to sort of move on. So I think it's a really great opportunity to just stay connected with the population that's hopefully looking for a way to move on.
You know, I think it's a good thing. My first time, but it's a good deal. No, yeah, I think it's in a good spot, good location, you know, easy accessibility, you know. I would like to take, advantage of the medical bus. Why not? I'm here, that's a plus.
We are meeting them where they are, where they feel comfortable. They're around people that they see every day through the word of mouth, or seeing one of their peers receive a shower or receive a shave or get their wound care addressed. So that's what we've seen with our project, that it's slowly kind of grown. We went there with one intent but realized that there were other needs, and we've slowly brought those needs to these individuals where they are at.
I think to treat our patients effectively, they really need to know that we're going to be there, and really be there locally and be there consistently, and give them a place where they can go and get a shower and get clean and get some clothes, and then see, oh, we happen to have some social services providers here that we can hook you up with food assistance or housing assistance. Obviously for these folks, getting to places is an issue. If if we've got something in Ventura and I tell our homeless patients in Simi Valley to just come on over and take a shower, that's pretty hard for them to do. That's a fair distance. If we don't have it close to where they are, it's just not going to happen.
So at the beginning, they were really hesitant to come out here because they didn't know who we were. They thought we were here to kick them out. But once they started noticing that we're here to help them, that's when they started coming out and actually telling other people that we were here. We started with maybe 10, 15 people at the most, and now we're up to 30.
The important thing, of course, is trying to meet people where they are, trying to be out in the community, and to do that on an even more effective level, we have to have more pods. So there's plans to expand the number of pods that we have in this community out to 6 pods and be able to be available in a more diverse geographic region. If we can connect to the most needy folks in our community and get them better access to services and really improve their health and their outcomes in that way, we all benefit.